Okay, here we go. Moving right along, we are now on Chapter 8, Lifespan Development. In this chapter, we're going to talk about topics ranging across the lifespan. So we're going to be addressing kind of what makes each of these age groups unique, from infancy all the way through late adulthood. When we're talking about an infant, we're referring to any child who is from birth to approximately 1 year. Sometimes that's difficult to know, so it's important to be sure you ask the caregiver or the parent how old the patient is to help give you an understanding for their anatomy and physiology. So when we talk about normal development from infancy, that birth to 1 year, we really see them born between 6.5, 7.5 pounds or so, 3 to 3.5 kilograms. By 6 months, the babies usually double in weight, and by 12 months, they triple their birth weight. The head is approximately 25% of their total body weight. So if you were to lay them out, a quarter of their length and their weight is going to come from just their head. So when you think about babies, we know that they're top heavy. Their airway is a little bit different. It's shorter, it's more pliable, meaning it's more easily obstructed, and it's more narrow than an adult or an older child's. The nose and the diaphragm are used for breathing. During infancy, especially early in infancy, these children do not understand that if their nose is plugged, they can breathe through their mouth. So it's very important to try to keep the nose clear so that they can breathe appropriately. Now we know as we get older, we're likely to get vaccinations, and that's going to help protect us throughout our life. However, in those very early months, antibodies are passed from the mother to the child during pregnancy, and antibodies are also passed through breastfeeding. So even though some of these infants have not yet received some of their vaccinations, they still have protection. Okay, so there are a couple unique reflexes that I want to mention here in the infancy stage. This developmental stage has 4 reflexes that we tend to grow out of with time. Just is a little bit different for each person, but by 1 year, these things are gone. The Moro reflex is also called the startle reflex. This is exactly that. It's when the infant feels startled, sometimes by bumping their bed or by making a loud noise. They will throw their arms out, their fingers kind of spread out, and they kind of grab whatever is nearby if they can. The palmar reflex is the idea that when an object is placed in the palm of their hand, they will wrap their fingers around it and grasp it. Now, this is a reflex early on in infancy. As they age, they do develop the concept of being able to reach out and grab something, but this palmar reflex is something that we see very early on, and parents go, oh, they're holding my finger. Well, it's really the reflex that you're seeing. Now, the rooting reflex or the hunger reflex, it is when we are trying to feed the baby, whether that's breastfeeding or bottle fed. If you brush the side of their cheek, they will turn their head to that side, looking or rooting for the nipple. The sucking reflex means that the lips will trigger that sucking reflex, and they know that that's time to eat. So you will sometimes see them stroke the nipple across the lips from a bottle or with the breast, and that encourages the baby to then latch on and begin sucking. There's a great deal of growth and brain development that's going on in this first year. So we talk about sleep patterns, understand that these babies sleep for a long time. So 16 to 8 hours throughout the day and the night. then changes to 4 to 6 hours during the day and 9 to 10 hours at night. Because while they're sleeping, they're growing. And we know, again, they're going to double that birth weight by 6 months and triple it by a year. Now, by 2 to 4 months, they usually will sleep through the night. They're not getting up for feedings and will take periodic naps throughout the day as well. The extremities are growing in length from a combination of growth plates at both ends of the long bones. Remember, we talk about the long bones in the lower and upper extremities. And those growth plates help to lengthen the bones, making the child then become taller or longer. If you recall back in the anatomy chapter, we talked a little bit about the bone structure. And another area to mention here with infancy is the fontanelles. So the skull is made up of plates. And in early infancy, we have these areas called fontanelles where the plates are not fused together. So there is one on top of the head called the anterior fontanelle, and there is one on the back of the head called the posterior fontanelle. Now the posterior fontanelle usually closes at 2 to 3 months, but the anterior fontanelle remains open for a longer period of time. If the fontanelles feel sunken, that may indicate dehydration. So when you rub your hand across the top of the baby's head, if you can feel that depression right there in the center, that could be a sign of dehydration. Now, if that fontanelle area is bulging, then that may be an indicator that there's increased intracranial pressure inside the skull. Now, please keep in mind that if the baby is crying, there is going to be an increase in that intracranial pressure. So with crying, you may feel that bulging, and it's not an indicator of a problem. It's just the force with the crying. So bulging fontanelles without crying could be a concern as well. So we've talked a little bit about that physical development that's taking place, but there's a lot of psychosocial development also occurring during this infancy stage. Bonding is the idea that the child, the infant, understand who's the caregiver and who's going to take care of them. They begin to recognize the voice and the appearance of that caregiver. They develop that trust versus mistrust. So they want to have a predictable environment. They want things to be in a routine, and that's what they're going to be more comfortable with. You're going to see infants that are in that predictable environment sleep better, eat better, and again, they will develop more smoothly. Scaffolding is learning by building on what we already know. And with infancy, they're going to begin with the very basics. And again, each developmental stage will continue to build on top of what they already have learned. So it's really important that we teach them correctly in the beginning, knowing that that is the foundation of their learning environment. And then temperament. They will react to their environment, and when we talk about infancy, remember this is birth to 1 year, so they don't have a language developed yet, and it's going to be crying or, screaming or just that frustration look on their face sometimes if they aren't getting what they want or what they need. So we're moving on to the toddlers. Toddlers are 12 to 36 months, so this is from that 1 year to 3 year mark. During this stage, these children are able to better control their body temperature, and that means, when they begin to get cold, they will kind of shiver more, and they can let you know if they are feeling hot or cold. Weight gain will be about 4.4 pounds or 2 kilograms a year, pretty consistently through this time frame. And the body systems begin to improve in efficiency, meaning things are working better and working better together. When we talk about the different body systems and we mentioned working together, the pulmonary system, the terminal airway branches continue to grow, and the alveoli increase in number. Remember those little air sacs at the end of each bronchiole. The nervous system is beginning to develop more of the fine motor skills. So it's more with grasp and picking up a pencil, the pincher grip that we talk about. The brain is 90% of the adult brain weight at this point in time. And now it's getting all of those little fine-tuned things adjusted. The musculoskeletal system is growing, so we've got an increase in muscle mass and bone density. This is because we are becoming more physical and weight-bearing. They're learning to walk and run, and this helps to improve that muscle mass and increase bone density. Now at this stage, they do become a little more susceptible to illness. Their immune system isn't as well developed, and some of those antibodies that they received from mom during breastfeeding or at birth, they're no longer functioning appropriately. So immunity is going to develop through exposure and vaccination. And when we talk about exposure, when kids go to preschool, a lot of times parents will say, oh my gosh, they're sick all the time, and they really are. And it's simply because their body is being exposed to these new illnesses and it has to learn how to fight them. Their teeth are all coming in, and we should have all the primary teeth by the end of this developmental stage. We also see potty training. Usually this is possible about 12 to 15 months because of the development of the musculature in the pelvis, but it's not really psychologically there until about 18 to 30 months when they really understand why and what they're doing. So physically, yes, they might be able to do it, but that's going to be with a lot of coaching from the parents or the caregiver, but mentally they're really not prepared until a little bit later. This can be a really fun stage because these toddlers begin to understand what words mean, and they start to develop that language. They understand cause and effect. So when I do this, that happens. They develop separation anxiety, meaning they know who those caregivers are and they don't want to be too far from them for fear that they won't return. They begin to develop some magic thinking, and that is where they begin with more imagination. They may develop an imaginary friend. They may, make the dolls talk to each other, thinking that they're real, or playing house and playing those make-believe types of activities. And again, the language is really going to develop quickly here. Moving on, we get into the preschool age, and this is ages 3 to 5. So those first two stages with infancy and toddler stage, we had a lot of growth and development. Things kind of slowed down here a little bit. So we continue to develop, but we're not making really vast strides like we were previously in the infancy, learning to walk, and then with the toddler, the development of language. We're building on top of those things that we've already learned. Now, psychosocially, though, we start to develop more social skills. We can work in small groups. We are familiar with different people outside of the family, meaning you might be recognizing firemen or police officers or, the grocery clerk, or even extended family and friends. Peer interaction gives a lot of opportunity for them to continue to learn. They are going to look at someone else of their size and they're going to try to do it. They want to be like them and they want to be a part of the group and they want to feel connected. School age, again, we've got a larger age span here from ages 6 to 12, and we've got some other changes that are going to begin to take place here. So they're really good at adjusting their body temperature or regulating their body temperature at this point, but their resting body temperature is a little bit higher than it was previously. They're going to be gaining some more weight now, about 6.6 pounds per year, and that's because we are growing 2.4 inches per year. Their primary teeth that were all in before, we've now gotten rid of those, and we've got our permanent teeth in place. This again is usually about the time frame when you start looking at braces towards the end of that school age year, because we know all of those permanent teeth are in place. With psychosocial development in the school age child, know that children are expected to be a little more independent. So we spend less time doing one-on-one supervision with them. They begin to develop some decision-making skills, and with that, again, they understand cause and effect. So now let's decide what's going to be the best steps to take in order to get the outcome that I want. Their self-esteem begins to develop, and this can be a difficult time just because we see a lot of cliques and things develop in the school setting and in some of the social settings with popularity and emotional support. Moral development also begins because they want to fit in, but yet they know right from wrong. And they understand that if I do something that's wrong, there's usually a punishment or something that's going to come along with that that could essentially be negative. Moral reasoning begins to appear more, and it helps to adjust the way that the individual really looks at their surroundings. Working our way into the adolescent group, this is ages 13 to 18. As we enter adolescence, that 13 to 18 year age group, we're looking at the development of growth spurts and sexual maturity. So 2 to 3 year growth spurts will begin. We'll see growing of the hands and feet, and then the arms and legs as the children get longer. With sexual maturity, they're starting to develop those secondary sexual characteristics, including breast development, body hair, increased body odors, and menstruation. During this stage, you'll see the adolescents really try to be independent, and they want to form their own identity. They are interested in sexual developments. They begin to become interested in their sexual preference. Their body image becomes more of a concern, and the way that they look or the way other people see them can be an issue. They're going to be more prone to self-destructive behaviors because of not liking themselves or not feeling like they're accepted or approved of by others. They do have a personal code of ethics that begins to develop, and identifying, again, what's right from wrong, identifying morally what they truly believe in versus what they are being just told. All right, early adulthood. This extends from age 19 to 40 years of age. And yes, early adulthood goes to 40. During this stage, physiologically, we are really setting ourselves up for life. So we've developed habits. We've got a way that we like to do things or a preference. We usually reach our peak physical conditioning around ages 19 and 26, somewhere in there. However, that is going to vary person to person because we know it just depends on how much work you put into it. So your body is prepared to be at its peak between ages 19 and 26. Psychosocially now, we've come to develop that independence and identify ourselves as hopefully who we want to be. So in early adulthood, you've got individuals who have established themselves with a job and with a family. They're probably under higher amounts of stress because of the demand for their time and money. Marriage, childbirth, raising children, all of this begins to occur. And Accidents are the leading cause of death for individuals in the early adulthood stage. And I will tell you that that's because during this stage, we tend to be a little more risk-taking, and we have some other behaviors that many early adulthood individuals kind of have to work their way through as they mature. Middle adulthood is focused on age 41 through 60. In the middle adulthood stage, we don't necessarily have a whole lot of improvements, I guess. We begin to wind down. So physiologically, our vital signs don't really change too much, but individuals in this stage may require some vision correction. They may have a harder time controlling their weight. They're more likely to be diagnosed with some health concerns, including cancer, high cholesterol, heart disease, or diabetes. And menopause begins for many women. Individuals in that middle adulthood developmental state psychosocially look at things as being more task-oriented. So we have a list of things to get done, and this is what we need to do them. Problems are more like challenges. They don't become as concerned with threats of things being taken away or of losing things as they are in the early adulthood stage. In middle adulthood, we start to see these individuals going through some empty nest syndrome if they've had families of their own as their children mature and move away. These individuals in this middle adulthood stage kind of have two directions they get pulled. One is dealing with the continued growth and development of their own children and entering their own life with a family and a job, but they also become concerned with their elderly parents and how much care do they need to extend to them, or are they dealing with major health concerns, and that can sometimes weigh on that individual in middle adulthood. Okay, now we're getting a little older here, and late adulthood actually just extends throughout the remainder of their life from age 61 and on. So we see a little more depreciation in their development and in their ability to overcome things at this stage. So their vital signs really depend on how well they are, their health, their overall well-being, and physical conditioning. The cardiovascular system is less efficient, and blood volume also decreases, so the heart has to work a little bit harder. The respiratory system also deteriorates, and this increases the likelihood or the chances of respiratory disorders. Now keep in mind, earlier in early adulthood or middle adulthood, they may have developed a cardiovascular or respiratory system issue, and that's only going to continue to worsen as they go into later adulthood. The endocrine system is changing, and the metabolism of these individuals begins to slow down. That's going to also increase weight gain for many of them. Their sleep-wake cycle is disrupted, and you're going to have individuals that kind of begin to, get up really early, and they have dinner really early, and they go to bed by like 8 o'clock. But everyone kind of develops their own sleep-wake cycle. And then other body systems also are deteriorating at this time. The body is just not as efficient overall, and things are wearing down and wearing out. From the psychosocial side of things with late adulthood, they face many challenges. They are looking at their living environment. Remember, they have been empty nesters. They're probably living with just them and their spouse, or they may be alone now. Maybe their spouse has died. So do they need to stay in their home? Maybe they're not physically able to stay in their home and they need to go to an assisted living facility or a nursing home during this later adulthood stage. They start to question their self-worth, and they don't want to be a burden on anybody. They also have financial burdens of their own because many of these individuals are on a very fixed income. And as I'm sure you all have seen lately, we have prices going through the roof, but yet our paychecks aren't getting any more. And these individuals, again, are typically retired, and they have to find a way to overcome these financial burdens, whether that's get a job later in life or begin to cut out some of the things that they used to be kind of extra in their life. They start to look a little bit more at death and dying. They know that they're approaching that stage. And although we have individuals that do die at younger ages, once you hit this late adulthood, you know what the writing on the wall is. We know that death for everyone is coming, and these individuals tend to focus a little bit more on it, try to prepare a little bit better for it. These individuals use motivation, personal interests, and activity levels to help enhance this stage of life. Some individuals in late adulthood become very social, or they join clubs. They can join fitness groups to try to keep themselves well and active. And so people in later adulthood, although many things are starting to deteriorate, their mind many times can still be very active and want them to be involved or part of something. Now, it's important for you to remember as we go through this chapter review, the physiologic and psychosocial development that takes place in each of these stages or each of these age groups. Remember, there are some key things that I kind of mentioned that's really going to take place if you've had children of your own, or if you've grown up with younger children and watched them develop. You might be a little familiar with some of those stages, but understand that what we're teaching you is the general population. So understand this is kind of a general normal that we're talking about. Again, there are psychological differences between these age groups as well. We have psychological differences with their medical conditions, with the development and the way that their respiratory systems are. And again, each stage has its unique challenges. I mentioned back when we talked about infants and those preschoolers, their airways are a little bit different. And so for that reason, this is an area that we in EMS need to pay close attention to, because when they develop a problem with their respiratory structures or with their ability to breathe, that can be very significant in the younger population. Something that you always need to kind of keep in mind is think about how you're going to communicate with these individuals. As we talk about the different developmental stages that these individuals may be in, think about how you would talk with them. Think about the words that you would choose or how you would structure your sentences when you talk with them. What is the best environment to talk with them? And do we want parents there? Do we not want a parent or a caregiver there? We want to be able to get trustworthy information. We want our patients to feel like they can tell us whatever they need to tell us. But in order to do that, they have to feel comfortable, and we've got to communicate to them on their level. We already mentioned infants do undergo big growth changes anatomically and psychosocially. That first year of life, they are learning all kinds of things, and their brain is a sponge. Now, as they get to be a little bit older and they enter that preschool stage, they're going to start to develop some independence, and they want to be able to do the things that they want to do when they want to do them, but they don't always understand the consequences that go along with them. So the psychosocial development is similar to that of toddlers. School-age children are going to be very logical and independent. They may have some regression into earlier developmental stages if they become ill or if they're injured. Sometimes we will see this also when a new baby brother or sister comes into the home, or if there's a change in the family dynamic, that can sometimes cause them to regress just because their environment has been so disrupted. Adolescents start to develop that psychological maturity, and they will start to come into their own, developing their own identity, and they're going to be faced with some difficult decisions and that psychosocial aspect of life. Talking about adulthood, we've got early, middle, and late. These terms are, kind of flexible, but remember, there are different development and conditioning things that we're going to see in certain areas. We know that there are unique psychosocial challenges across the adulthood, and it's going to vary which stage they're in and what the most important things to them are going to be. So think about this. How do I approach a patient most effectively based on developmental characteristics? One of the things I want you to do is make sure that you are communicating at their level. And when I say that, I mean at eye level. If you're talking to a toddler or a school-age child, you may want to get on your knees. You may want to squat down so that you can look them in the eye and show that you're trustworthy, and then develop that rapport with that person. If you're dealing with an older person, make sure you ask them what they want to be called. Maybe if they're from a certain generation, they want to be called Mrs. Smith. They don't want to be called Dorothy. And use that patient preference to help establish, again, that relationship with the patient. So does the age of my patient pose any assessment or care challenges based on physiologic development? Absolutely. We talked about how the airway in younger children is more easily obstructed. We know that as we age, the body systems start to deteriorate. And we know that medical conditions are likely to occur in middle adulthood or later adulthood, and these individuals may be taking medications because some of their body systems are not functioning normally. But we also have to identify the fact that sometimes physiologic and psychologic don't match up. So you may have an older physical person standing in front of you, but mentally they may not be at that same developmental stage. So identify what is normal for this patient and how am I going to be able to best communicate with them. All right, quick scenario here. You are called for abdominal pain in a 16-year-old girl. She is with her friends at the park. She seems hesitant to answer any of your questions. So what characteristics of adolescent development is most likely the cause of this, and how can we overcome it? Well, when we've got a 16-year-old, remember they are very much going to change the way that they are in order to keep their friends. They want to be independent. They want to be looked upon as being part of that group. And so getting them by themselves may be beneficial so that we kind of take out the friends and we can talk with this girl one-on-one. Understand that this is a time of sexual development as well. And so there may be some very personal questions that we need to ask, and going to a more private setting may be better. When we talk about these 16-year-old girls, there's a lot of things that should come through your head with abdominal pain and a whole slew of questions that we're going to teach you to ask. So try to get the most accurate information in a setting that's going to be more comfortable for your patient. All right, there you go. There's chapter 8. I wish you all luck on the quiz.